These are the National Health Singers, a national choir founded by some of the 53,000 junior doctors who work in our NHS. They're singing for its survival. The National Health Service is the only service that we have that will be there for you your whole life, night or day, when you ask for it and when you need it. That's what it exists for, that's why it was founded, and that's why it's the best thing that we've ever done. The government wants you to believe that that's not true. The political narrative is that the NHS is so stretched that if you come into hospital at the weekend, you're more likely to die, which is a toxic, politically motivated manipulation of deeply flawed data. The new contracts for junior doctors have been tied into this political lie in the hope of saving money on the backs of doctors and their well-being. It's essentially an attempt to stretch out the doctors we have now into working more hours for no more money. And it basically boils down to whether we should protect working conditions for people who are doing potentially incredibly dangerous jobs. And the answer to that question is, of course, yes, we should. The contract is preparing the way for an attempt to privatise as many elements of the NHS as possible by destabilising the national consensus that it's one of the best emergency healthcare systems in the world. The fact is, we spend proportionally less than France and Germany on public healthcare. It's highly efficient. We have an incredibly motivated, trained and passionate workforce who are predominantly not in it for the money. They went into medicine and nursing to help people, and they're making enough to get by. So if we reduce their wages by changing how we classify their hours, which is what the government wants to do, then they'll leave because they can't pay their mortgages and they can't feed their kids. At which point the Conservatives will announce that it's rubbish and we should bring in Richard Branson. But the fact is that targets and efficiency and economics are not the whole story when it comes to the NHS. The more you need the health service, often the more expensive your care is, and that's not what private money's interested in. Private money's interested in profits. The NHS wants to spend the money it needs to spend on you because you're sick, and that's why privately funded healthcare as a national solution just doesn't work. When I watched the Olympics opening ceremony 3 years ago with everyone else, everyone I know felt incredibly moved when we saw Danny Boyle's love letter to the NHS. We felt pride because the National Health Service is the best of us.